Good evening, everyone. Thank you so much for staying. So I am Prabhat. Uh, we are from DreamSol, and I'm going to present some 7 case studies today, which we have transformation case studies basically. So, let me quickly go through this. We will have QA also in the last actually. We can accordingly kind of take this on. So one of the questions that we have is, what is the common among all of these big shots in healthcare wellness? Can anybody tell me? Right. So we have a special prize for somebody who has said DreamSol. Very simple. They leverage our enterprise productivity management applications. We are trusted by around 200 plus hospitals across 8 to 10 countries. I'll again go back. We are working with Medanta from last more than 10, 12 years now. Entire Apollo, entire Max, Aster, lot of other brands actually. And we are blessed to, learn from these brands. And we have identified lot of niche gaps out of this, and then we have kept on improvising ourselves actually. Now, there are 3 things that we have always focused on to. And these 3 things are very important actually. First is patient experience. So under patient experience, we have multiple solutions that we have given to these brands. Then we have patient engagement. And third one is more on operational excellence. So these are the 3 areas that we have kept on focusing on. And we always have said, whenever we go from Medanta to Apollo to Fortis to Max to whatever brand, we always said, whatever you will advise, we will customize to the nth level. So that is how, and that was one of the key success stories for us, not only in India, but for all the other countries that we have kept on working on to. There are a lot of things that we did on patient experience actually. We have literally decoded the various touch points which are available, whether it is for IP, OP, or any other kind of journey actually. So here you can see, we have various, when we talk about patient experience, even before the patient takes an appointment, there are a lot of AI-based proactive alerts that we generate to the hospital, and basis that they are very well prepared actually. If some patient has indicated that last time, they want South Indian food and they had some complaint or, any preferences that they had or any special, kind of request that they had, we could actually take through them. Similarly for OPD and all, we have lot of such, kind of, for every milestone, we have some or other kind of scenarios for it. CRM is something that we have created actually for healthcare. We have at multiple organizations, we have replaced the big CRMs of the world actually, which are US based, and I would not take the name, but those CRMs were not made for the healthcare actually. We were the first company who have actually identified the various milestones into it. Hence, we have something for lead, we have something for wellness CRM. There are various milestone based, kind of things which we can do. There are sales productivity tracker, mobile app based thing, which each of the salesperson can carry with them. And it's so user friendly that they get to know what has to be done by them. So this is how, we have been working on to partner relationship. That is one of the important element for healthcare. Then we have Marcom, which is more of a marketing communication, very digital, personalized kind of communication that we have done. Now, one of the important things that we did for operational excellence also was for healthcare. We don't have something like John Hopkins and other kind of model in India. So what we did was we went to those large hospital groups and we identified various niche gaps. We have identified the process, as you can see over here. Then we identified various owners for that TAT-based, milestones for radiology, for lab, for whatever process that we created. And then there were a lot of dashboards. These dashboards are more about the exception report rather than just giving what is going right actually. So that was the key element that we had done. And we had a lot of tools around it on the operational excellence. Medanta alone uses more than 20 plus tools actually from last many years now. And, we could kind of replicate it for other groups as well. Now, let us talk about what transformations that our tool have done into healthcare actually. We have been talking about innovations since morning. Tomorrow also we are going to discuss on the same. So there are 7 success stories that I want to share with you that we did for various healthcare groups, which actually have kind of transformed the process the way they were working actually. One of the first thing that we did was, and this is one of our hot selling thing, for this itself, it is being used more than in 200 plus hospitals actually. So one of the challenge which these hospitals or clinics or pharmacies were facing was, they were having lot of complaints through different platforms. They had created digital platforms, with new age thing, but how they can do the sentiment analysis out of it, how they can create certain service excellence parameters out of it was a challenge. So we created a complete platform basis various, insights which we were getting, the kind of recurring complaints. So every department could get an improvement dashboard for next 3 months, where is there that they have to focus on, So if for one hospital, if there are 30 different departments which are working independently, our tool can give them an independent process improvement dashboard where they can focus on, and they can see over trend in last 3 months, last 6 months or next 6 months, where are they improvising actually. So this is how we did. So that's why we call it like, title you can see it is like creating a wow experience for those patients actually. So converting these complaints for wow kind of thing, because these are the areas of improvement actually. Let me give you a very simple example of one hospital in Delhi itself. It's a semi-government kind of hospital. The CEO dashboard indicated that in one of the block, patients were requesting for water cooler actually. The patients used to go into different block in order to fill their water. So they have just put in that, water filter or water cooler into that department. Some suggestions like that, which can actually change the way the patients are facing. This is just a simple example. We have something called seriousness assessment metrics. First time in the industry that we did. We have 700 plus categories of those severity 1, 2, 3, 4 basis NABH JCI guidelines, wherein the department can find out what is the training need identification for them. So the L&D department gets their own dashboard automatically generated from these platforms. So you can imagine departments getting their own indicators, the areas of improvement, L&D department getting their own, training need identification, and they can see the effectiveness of the training as well. After 3 months, whether the nursing communication has increased or not. So these are certain things which, has turnaround things actually. Second, one of the very important thing was, there was no typical complaint management system for the hospital before we started off something in India actually. The largest of the Asian healthcare hospital, they were using US-based company, SaaS-based, which was not customized for healthcare. Now here what we have done is, on the best side, there are QR code, and they can just simply scan, they can see what is their demographic details, they can request any complaint, any request that they can give, and everything has a turnaround time for it. So one of our hospital, they are addressing more than 50,000 such requests in a month through this. So collectively, if you talk about, we were trying to get a number. So the entire group of hospitals we are working on, whether it's on the feedback part or on these complaint requests, every day there are more than 10 lakh such requests that our tool handles actually. So you can see the kind of difference that we are trying to create through this, not only in India, but everywhere, wherever we are working actually. And we got a lot of awards and a lot of other things for this. Now, third is very important actually. There are a lot of call center CRMs available. Typically what they do is, they record the queries which come in. However, our tool here, what it does it, that not only it records, but then it transforms into certain revenue parameters out of it. And we can actually monetize that these are various parameters through which this hospital can actually get more appointment or more, diagnostic tests. So there are certain indications basis the queries that they get. And then there is a direct correlation that we did. The case study over here, as you can see, one of the largest Middle East clinic chain or pharmacy chain is using it, and there are more than 100 plus call center users who are using it while they are doing their normal job, but the tool in the backend through their dashboards are indicating where is that the focus should be, which is the pharmacy which they need to order more, or what is the kind of diagnostic test that they can generate. So that is how we are transforming the customer queries into more of a revenue kind of thing. Now, patient safety becomes one of the important tool actually. So we created an audit checklist tool which is very mobile friendly. Any user, just imagine one of the largest hospital of Mumbai, the fire officer there in his phone actually carries our app. Before us, what he was doing was, he was taking one copy and he was noting what is the gas reading, when was the last inspection done. So there is a checklist. So whoever is associated with hospital for every department, whether it is in IT, biomedical, engineering, whatever department that you talk of, there are a lot of checklists on which everyday person works. And these checklists typically are filled, whether it is nursing department or any of such operation department. Now, through this mobile app, when they log in the morning, they get to see that this is the checklist which is due. They can just simply click on it. All the questions are available. It can take a picture, it can take a voice recording, and in the backend, it creates a dashboard which gives us the compliance report actually. So earlier, people were noting on the copy pen, and then, they were kind of going into Excel, putting it up, and then they were generating certain reports. Now here, everything is, on real-time basis, and if something goes very wrong, there is an escalation engine also built into it. So the HOD can be alerted that, in that particular building, so-and-so equipment is not working, and it really needs to be replaced immediately. So those are the things that we have created. So those benchmarks is something which is important for patient safety as well. Now, asset management is one of the important tools for any hospital. If you see the difference between hospital and a hotel is more about this biomedical assets to be functioning well, engineering and all. So we created a tool which is talking with each other actually. The complete stages right from procurement till the condemnation, there are different stages, and it works very simple manner. All the L1 engineers. So the best part of our tools are that these are very user-friendly kind of tools. Otherwise, this may not get that success out of it. Now, one of the other thing that we have is operational excellence, which I told, which we are working with a lot of hospitals, wherein we created those, gaps, and we have kind of worked on it. This is the last thing. And here what we did was, for the largest hospital chain of India, which is around 40 to 50 hospital group, they were using one of the largest US-based CRM before us. Now they are using our CRM, and the salesperson in the morning itself, when they open the app, they get to see that this is the work that they have to do. It is a geo-tracking based kind of app, whether they have to go to meet the doctors or to their corporate or wherever, it takes care of everything. It integrates from the HIS, it takes care of, the revenues and everything. So there are a lot of dashboards with respect to it. These tools are very user-friendly, useful on Android and, iOS and all those platforms. Again, some of the dashboards, very insightful dashboards that we keep on giving. For every product, we have more than 20 to 50 plus dashboards which are available. About us, we are 19 plus young company, and we are based out of Noida, and we are working for 10 different countries, for different brands. We are made in India, made for world kind of company, and we are totally bootstrap, and we are good to, kind of work with all these brands that we have been working on. I have just 10 seconds left and I am done. Any questions, please let me know. Thank you so much, everyone. Thank you.